suffering from laxity concerns as well as maybe textural concerns with fine lines, widened pores, and maybe even crepiness of the skin. In this video, we will be talking to you about radiofrequency devices and treatments such as bipolar radiofrequency, which is non-invasive, microneedle radiofrequency, and also radiofrequency-assisted lipolysis. Morpheus 8 is basically a subdermal adipose remodeling device, or SAD for short. It's basically a microneedling radiofrequency device, and it comes in a variety of pins. They're all semi-insulated and can deliver energy at varying depths between 0.5 millimeters to 7 millimeters in depth, and this is selected based on the area of treatment. Morpheus 8 is basically an extremely versatile device that's suitable for all skin types and all skin tones. There are a number of indications it can treat, and it can be ranged from the facial zones all the way down to the body, the thighs, the upper arms as well. On the face, for example, it's great for improving the skin complexion. It can be used to treat enlarged pores, also uneven skin tone and uneven skin texture, such as acne scars and that caused by rhytids and wrinkles. It can also be used for tightening as well because it's very good at inducing collagen in the dermal layers of the skin. It can give rise to collagen and elastin formation. You can get increased firmness and tightening, especially around the cheek and the jowl area. It can be also deployed deeper. For example, when you look at submental fat, it can be used to reduce the fat layer in the area as well as tighten the overlying skin, giving rise to a firmer, more well-contoured jawline. Lower down on the body, it can be used to improve crepiness of the skin. So for example, in striae, it can be very useful, as well as improving scar quality over areas where there has been previous trauma or injury. It can also be used to improve laxity over the inner arms, thighs, as well as the abdomen as well. And hence, you can see that it can be suitably deployed for a number of different conditions depending on your indication. Morpheus 8 is generally a very safe treatment if a practitioner knows what he is doing. Now, in terms of downtime after the procedure, there's usually some associated redness and also maybe some swelling in the facial zones, and this can last maybe between a day to two. Now, typically, this is much less downtime when compared to other fractional remodeling devices such as a fractional erbium or fractional CO2 ablative laser treatment. Now, with regards to photosensitivity, it's also much less as well, but generally it is useful to avoid strong sun exposure and also comply with the aftercare creams that your practitioner has prescribed for you. Morpheus 8 can absolutely be combined with other aesthetic treatments. Now, it's important that your practitioner has a wide range of toolkit available to customize and to individualize preferences as well as indications. For example, while Morpheus 8 may be very good at remodeling the skin, so improving skin tone and texture, it can't really treat pigmentary concerns. So it may be useful to combine certain things such as chemical peels to effectively improve and brighten the overlying skin tone and pigmentary concerns by lightening that, and also can be utilized with certain other lasers such as a picosecond laser to treat effectively surface pigmentation such as affiliates, lentigines, as well as dermal pigmentation. It can also be combined with other things such as injectable treatments, which are very widely available. So you can utilize Morpheus 8 together with certain treatments such as botulinum toxin, as well as dermal injections of hyaluronic acid to improve and correct things such as volume loss. It can also be utilized to smoothen out fine lines further because sometimes you have a combination of both dynamic and static rhytids. As mentioned earlier, almost everybody can find a suitable indication for Morpheus 8 treatment. And now why I say this is because as a microneedle radiofrequency device, it is safe for all skin types and all skin tones. So that already puts it as a good choice for multiple candidates. So if you're looking at a rejuvenation procedure that helps to improve your skin quality as well as your skin tone and tightness, this is one suitable treatment to treat across all those layers of the skin as mentioned. Again, although it is suitable for a wide range of people across all skin tones with a number of different conditions, not everybody is suitable for this treatment, and it's best to check with your practitioner before proceeding with such treatments. InMode Forma is an FDA-approved bipolar, non-invasive radiofrequency device that allows you to deliver energy precisely into the skin to optimize collagen remodeling and build new collagen. This allows you real-time temperature control for optimal safety as well as efficacy. A monopolar radiofrequency device typically utilizes a stem technique. So what it does is that it requires fast movements, basically with high peak temperatures and lower exposure time for safety. In comparison, Forma utilizes a slower build. Lower energy or lower temperature delivery over a prolonged exposure time gives you more opportunity to more effectively remodel the collagen. And of course, safety is a paramount concern to everybody. Forma utilizes real-time temperature monitoring. Now, it monitors your skin 1,000 times every second to ensure that the temperature is well regulated within the safety parameters that you set it at. This is compared to a lot of other radiofrequency devices where the temperature control may not be as precise as it is with the bipolar technology. It is important to note that every radiofrequency device has its own set of unique properties and unique protocols to ensure safety and efficacy. Forma can be really useful for treating the lower half of the face, in particular the lower eye area, the cheek zone, and the submental area. It is also useful for the neck zone and the décolletage as well. The recommended number of sessions differs depending on the individual as well as the area being treated. This can typically range from a number of 6 to 8 sessions and can be spaced about 2 to 3 weeks apart for optimization of results. Now, while Forma and Morpheus 8 can be utilized separately, it is great when used synergistically together for a hybridized treatment. By doing so, you allow Forma to basically preheat the skin to allow for collagen remodeling and tightening of the skin, and then this makes the Morpheus 8 treatment subsequently more effective as well. Now, on top of that, you can also utilize a third component, which is what we call RFAL, or radiofrequency assisted lipolysis. RFAL is a further treatment that you can utilize that basically tightens the adipocyte tissue, reducing it, as well as using the septal-facial fibers to tighten the skin even further. This is non-surgical without using an excisional surgical technique, and hence it is sort of like a mini facelift of sorts where you can actually enhance the results built on the Forma and the Morpheus 8 to a greater degree, especially for areas such as the submental zone and the jowls, where you want further tightening and improvement in the contours of your jawline, for example. Now, RFAL basically targets unwanted fatty tissue and also tightens the septal-facial structure, so giving rise to even greater improvement non-surgically. So this is a form of non-surgical facelifting. So if you're not up for doing a full facelift, then you have severe jowling as well as submental fat over the jawline area. Now, RFAL may be a suitable option to treat this area more effectively. So it can be deployed on top of Morpheus 8 as well as Forma to actually improve the skin across all layers to not only eliminate unwanted fatty tissue but also to better tighten and remodel the skin. RFAL is a more specialized medical device that should be only employed by trained professionals. Now, for the dual hybrid treatment, if you're looking at Forma in combination with Morpheus 8, typically I would say that 6 treatments of Forma in combination with 3 treatments of microneedle radiofrequency will be very good and effective for a particular zone of treatment. Of course, this again varies according to the severity and the indication. Now, when we use all 3 technologies, including the radiofrequency assisted lipolysis, there are various ways of combining it more synergistically. Now, RFAL can sometimes be combined with microneedle RF on the same day, and microneedle RF can also be combined with Forma on another day. So together, we will rotate them through treatments because RFAL is typically only required about once and not more than twice. And this is usually spaced up 3 to 6 months apart. So for radiofrequency assisted lipolysis, we don't repeat these treatments that often. Now, microneedle RF, however, can be utilized more frequently. Typically, around 3 to 4 sessions may be needed if you still want to further tighten the neck zone, for example. And then you can use Forma more as a maintenance treatment. Now, let's first start with who is suitable for just Forma treatment. So if you have very, very minor laxity issues, you're quite young, you just want some tightening, some maintenance treatment, you don't need something too invasive, then Forma is a suitable maintenance treatment for you. On the other hand, if you have moderate laxity and also a little bit more concerns with maybe textural changes, then I would recommend doing a combination of both Forma and microneedle radiofrequency to target more layers of the skin from the epidermal down to the subcutaneous fat. And this is better for more middle-aged patients who also have some concerns with laxity as well as concerns with overlying enlarged pores and fine lines and wrinkles. Now, the third option, which is a triple combination, is suitable for patients who've got maybe a lot more laxity and a lot more submental as well as jawline fat. So in patients like this who are not wanting to do a surgical option such as a facelift or neck lift, then this might be a step before that you can try something less invasive like the RFAL to try to effectively sculpt the area and contour the area more effectively, and then combine it together with more Forma as well as microneedle RF to better improve the skin quality and further improve collagen production in the area as well. So in summary, today we talked about radiofrequency treatment. So we talked about non-invasive RF such as the Forma bipolar radiofrequency device, we talked about microneedle radiofrequency, and we talked about RFAL, which is radiofrequency assisted lipolysis. So we talked about radiofrequency devices as a whole, And if you find that you might have a number of concerns to target with these treatments, don't forget to contact your dermatologist. If you enjoyed this video, don't forget to like and subscribe to our channel.